One of the common things that we see in our clinics and that we enjoy treating is shoulder instability. And it's a very common problem because the shoulder joint itself is inherently unstable. It has a lot less bony constraint than other joints of the body. So it really relies on the muscles and the tendons and the ligaments surrounding it, as well as something called the labrum, which is a thickening of tissue that surrounds the socket. And essentially the shoulder joint is like a golf ball sitting on a tee. And so when we have our younger athletes, higher level athletes that are doing activities with their arms away from their body, if any sort of trauma happens in those positions, it can cause the ball to slide out of the socket. And when that happens, it tears some of those structures, most commonly either the capsule or the labrum. And so when we see patients with these problems, there's several different things that we have to take into consideration. There's the injury to those soft tissue structures, but also, depending on the nature of the trauma, sometimes the bony structures can be involved as well. And that helps us determine what the best treatment is going to be for that patient. Some patients can do okay without any sort of surgery, but we know that especially higher level younger athletes are prone to having more dislocations in the future, and we want to prevent the pain of those injuries, but also prevent what can happen when we look 20 years down the road when people might develop arthritis earlier than they would have otherwise. So our treatment options for those, if we are looking at something that might need surgery, can range from an arthroscopic procedure, which is a minimally invasive procedure with small incisions. We use a small camera to fix some of those structures like the labrum and the capsule and the ligaments that may have been damaged. But sometimes when people have had some compromise of the bone or things like that stabilize the shoulder, sometimes they do need a bigger surgery. And sometimes that requires making a larger open incision and using bone either from elsewhere in the body or sometimes from a cadaver to build that socket back up and give them the stability that they need. Even with those open procedures, patients do very well, and we're able to get people back to whether it's labor-intensive activities or high-level athletics. And it takes people 4 to 6 months, but they are able to get back to the things that they either need to do or enjoy doing.